Thank you for holding a seminar on or a talk on such an important topic. And we often forget, we take psychology very lightly. So what happens usually in our practice is that, the doctor looks after the patient and he is categorized as obese or overweight. And then the patient is referred to a dietitian that, you go to a dietitian, take a diet chart. We have whatever the dietitians are practicing, maybe it is a intermittent fasting, or maybe it's a keto diet, or maybe so many other kinds of fat diets, or maybe just calorie restrictions, or very low carbohydrate diets and high protein diets. Whatever practice they have, they would just ask a little bit about their food patterns, and they would feel, it is varies from dietitian to dietitian what they are practicing, that they give a particular kind of a diet to a patient. And we seldom or hardly ever has a psychologist sitting with us in our team, right? It often happens that when the child, or I'm so used to saying child because I'm a pediatric nutritionist, but whenever a patient is not able to lose weight, then we think of, okay, he may be having some behavior issues, so why don't he sees a psychologist. And also, they have inhibitions, they have a lot of barriers going to a psychologist. So I always feel that psychologists should be sitting in the same room where the dietitians are sitting, and listening to the patient, how we are taking a history. And then, she gets a clues from there, whether the person she assesses whether the person has behavior problems, or she can even ask, she can have an independent session later on, and then the dietitian and the psychologist can discuss, okay, these were the issues with a child. What happens is, usually in these kind of diets where, very structured intervention, any kind of intervention, dietary intervention plus physical activities told to the patient, usually they lose weight up to 4 to anywhere between 5 to 10% the next 6 months. And then there's a plateau and there's a frustration. They are not able to lose weight. Usually in the fat diets, they put on the weight again, right? Because they have to be actually motivated constantly, and their behavior issues go hand in hand, side by side, parallelly, as we do the diet. So it is not independent. The issues are not just confined to a doctor or a dietitian or a psychologist independently. It has to be together. It is a team who works together on a patient. That is my take on a psychological side of it.
Right. Dr. Sona, what would you like to comment on?
Thanks, Rita. I think what has been my tryst with exploring obesity as an endocrinologist is that what I like to start with is really comes back to a weight history, as I would like to call it, and in that I need the perspective of where is this patient coming from? What does the family history look like? How does obesity run in the family? It could be, a genetics. It could be just the fact that the milieu in the family is setting this person up. How their weight was when in their initial years, usually their pre-pubertal years. How did puberty happen? What was the weight like in puberty? What happened when they went to college? What happened like when they got a job? So that, and because unfortunately, people have been so used to being judged that there is a lot of hurt, there is a lot of trauma, there's a lot of pain. So, getting and teasing out history is not as easy, and it needs a lot of empathy, a lot of us with them also to kind of get into their shoes, so to say. I'd like to know what's happening in their life. I like to know intentions. All that is kind of key for me to kind of get a sense of where are the interventions likely to kind of merit them most. Is it a knowledge issue? Is it more of a behavioral or unable to manage their emotions issue? Is there relationship? I don't give a foundation for leading on to the next person I send the patient to. I think the patient is not going to go anywhere. And typically, as Anuja said, is that what typically happens is when they go to a dietitian, they just take a diet history and tell them do this, don't do that, do this, do that. And most people have diet sheets, n number of diet sheets in their file. It's not about not knowing that. And that is why I think now, as I see, if you look on social media everywhere, there is this concept of sort of being a nutrition coach or a health coach, because really what people seem to need is a friend on the side and an accountability partner, and sort of form those behavioral changes. Now, the practical problem is a large middle class, and you're not going to be affording that kind of coaching, or so we'll have to make do with what we get. And I practice at a hospital which caters to a large segment of, say, lower socioeconomic strata. I have all across the board. And every strata has a very different set of problems. And I think the most important thing which I have learned is listening to my patient and understanding their struggles. Start from and meet them where they are and find out solutions that will work for them, taking into consideration what are their preferences, so that we can work something that is sustainable. Because I think that is where, like Anuja was saying, the real problem is people will keep yo-yoing. And I always insist, this is not about a diet. It is not about a target. It is about a marathon, a process, a commitment to a process, and we do little steps which we keep building on. It's about habits, new habits that we have to replace with the old habits, and educating what's happening behind the scenes, because I believe that is the fundamental part. We tell them why they have to do this, this, this. We don't tell them why and where they're going to benefit, how everything comes together, the whole thing put together. I think that makes a huge difference, and that's what I've felt benefited most of my patients.
Right. You're right. Definitely, knowledge makes a lot of difference in answering the why question. Ki kya kyun karna hai? So that is important. Isha, so are you there? Please unmute yourself.
Yes, ma'am.
Thank you, Isha. So, what's your take on we are talking about behavior change in the management of weight loss, and so what's your take? What do you feel?
First of all, very good evening to all of you, and very kind thank you for Anuja ma'am, Shweta ma'am, and Dr. Sona for their kind words. Ma'am, my take on weight loss is, as already it has been addressed by Anuja ma'am, that there is a great role of psychology when it comes to weight loss. A person's personality factors, their behaviors, which may need modification, their ability to adhere to the treatment that has been advised, all these factors play a great deal of role in individuals' weight loss management. Additionally, there may be other psychological factors which may interfere with the person's ability to stick to the treatment or the diet plan or even the exercise plan that has been advised to the client. So without understanding the psychology of a person, it is difficult for us to work in any area with that particular individual. And especially speaking of weight loss, which is very strongly correlated with our body image, our confidence, our self-esteem, it becomes even more difficult for a person who has been overweight for a long period of time, and they're already carrying those inadequacies deep within themselves, maybe their inabilities to, handle their emotions in a more healthy manner. So all these factors continue to affect the person's ability to lose weight, and the cycle keeps on going. Without an appropriate intervention, when there is a cycle, there are different points of cycle that connect them together. So how we work with clients is we try to break that point, one point anywhere in the cycle. At least at some point, the cycle needs to discontinue. So let's say the person is having emotional trigger, and then the person is not able to cope with the emotion in a healthy manner. then the person is going to overeating, and then later the person is feeling guilty and feeling, again, low self-esteem about or having a poor body image. Some point, if we can break the cycle, it just stops the entire cycle from continuing. So these are the ways that we work with clients in every area, and including managing their own body weight.
Right, right. I mean, I would like to know, I would like to understand first from Anuja ma'am. Ma'am, you've seen so many patients, you see children and you've seen adults, and it becomes very difficult to for us to tell them कि उनको पता है, they'll be knowing that they should not eat this. Let's say a diabetic child, उसमें तो child, so I think it's even more difficult to handle, right? But let's say think of an obese child or an adult, and they know they should not eat. They have the knowledge. At some point of time, everybody has been telling कि नहीं, कम खाना है, calorie intake should be less, and what are the right choices they know, but they still, once the food is in front of them, they can't stop. So is food just like an addiction, just like a poor impulse control thing?
Yeah, it is actually food as such. You can't say initially, food, basically it's a necessity for us to live, right? So we, our brain definitely controls us, what we have to eat, how much we have to eat, when we have to eat, our hunger cues and everything. Definitely our brain controls us, but addiction to food is not a neurochemical dependency, as such. You can't call a obese child just like a binge disorder, binge eating disorder. You can't categorize in that. But then they have a tendency of eating a lot of, a tendency of getting attracted towards sugary things, right? That is the first, carbohydrate based things which attracts people, and they can't sort of stop themselves eating sugar. And if you add some fat in it and also some salt, it becomes additionally interesting for them to eat. So their sweet tasting foods are the ones who are most preferred in this. And then the quantities they consume, these quantities, they may start initially with small quantities because that interests them, and later on they start taking huge portion sizes. And that's why we talk a lot on portion sizes, because there is a capacity in them to eat a lot of these refined carbohydrates, fats, and salted things, right? So a substance's addictive potential is increased by its potency and its rapid absorption within the gut. So how rapidly a thing gets absorbed in the gut, obviously these are all refined things, they get absorbed quickly in the gut, especially carbohydrates, sweet things and refined carbohydrates. So you start feeling hungry again. So your brain instructs you, again, you have to take something else. So like that, their portion size goes on increasing. They get, kind of addicted. You can say in a way, I don't know. I mean, Isha can tell better that, can you categorize it as a binge eating disorder or not? Right? So it is something like that, it is governed by brain and you just can't stop yourself. So once you get, so that cycle, again, she's talking of that cycle that has to be broken. But then it is also depends on how much of it is available in your house. The family is a big responsible for it. The environment, the community is really responsible for it. How easily it is available, you're accessible, right? So and so many times, I can talk about the mothers, parents who come, they are themselves very obese, right? And they get the child who is obese, and they say, "Mera to nikal gaya zindagi, abhi इसी को बताओ," and then the child, can you obviously sense this child is being nagged at home कि ये मत खाओ, वो मत खाओ. But what about you, right? So it's a whole family which is responsible, the environment in the family. You're sitting and watching a TV of your favorite serial and eating in front of the TV, but then the child eats, you're refusing. So it's a whole family which who has to actually support this obese person, whether it's an adult or a family, I mean a child So your fridge is full of chocolates and all that. This has become the in thing nowadays. I never thought when I grew up, our fridge had chocolates or ice creams. Now chocolates and ice creams become a way of life. It is there in everyone's fridges, right? So you can just take out and eat. So our own lifestyle, the way, the fast pace of life, so it is being rewarded at times, especially in case of children. So you feel guilt that you are away, the parents are away, and then you sort of reward them with these things which are actually junk, and they are actually adversely affecting their health. So I think your mind, gut, and your potency or intensity of what you want and how much you want is actually governed with all these things. Yeah.
True, true. I think it's the reward system that gets activated. And point of time there was dearth of food. At least wheat bhi nahi tha, and there was like wheat was getting imported in India. At least in India.
Shweta, can you increase your volume a bit?
Can you hear me? Can you hear me?
Yeah.
Right. So I'm saying there was a time when wheat was also not there in India, and there was dearth of the fast food and the processed food. And for example, people could have a soft drink in the functions or the parties, and now because of the ease of availability and the guilt phenomena that the parents has, right, there is increased consumption of the processed food. And what do you think, Isha? Like just like ma'am said, is like, what about the binge eating pattern and the impulse control thing that you feel like? How can that be? Isha, you're mute.
You're muted, Isha.
Thank you, ma'am. Anuja ma'am ने already काफी सारे जो complex points होते हैं which are associated with a person who needs to work on their weight loss, including parenting and how parents are supposed to role model in front of their children for any particular behavior that they want their child to acquire, including healthy eating habits. Ma'am ने already बहुत अच्छे से उसको highlight किया. Additionally, when it comes to binge eating or impulse control, there are two separate identities, concepts, if we look at it. But beyond a point, when we speak of addiction, whether it is food addiction, whether it is gambling addiction, whether it is drug addiction, from the neurobiological point of view, ma'am, addiction ka pathway हर type of addiction में same हो जाता है. So with the binge eating as well, after a certain point of time, जब tolerance बढ़ने लग गया है, उसकी need frequency बढ़ने लग गई है, so it does start taking a form of addiction in the brain as well, just like any other drug. And when it comes to impulse control, we don't necessarily associate it with addiction, but then they are also strongly correlated. So in a person with addiction of any kind, we also see their tendency to, not able to have that control over their impulses. So whenever we have to work, whether it is body weight or any other kind of addiction, हमको दोनों ही areas पे काम करना पड़ता है, including impulse control. And that is where we take care of the execution and planning for the individual, preparing them in advance कि अगर emotional cue आया तो आपको क्या करना है, what will be your plan in action and how you're going to execute it.
Right. Dr. Sona, what type of psychological challenges do you feel you face in your patients?
Yeah, just a quick, back up to what both Anuja and Isha have said. See, I think with the advent of the newer weight loss medications, injections, and the GLP-1 analogs, I think we have furthered our understanding about so we now know that there is a drug which can help you lose about 15 to 20% body weight, as close as to bariatric surgery. And the question is, how does it work? So we thought initially that how GLP-1 analogs work is by slowing the gastric emptying, making us feel full. That's one component. But we are starting to increasingly understand that the major effect seems to be on the brain, in the satiety centers. And if you look at the people who lose a lot of weight on these analogs and those who do not lose as much weight on these analogs, it all comes back to the concentration of these drugs in the brain. And there is also, that's kind of why the injectables seem to be working even better than the oral semaglutide which is available. And what has been studied, even in those patients who are on these drugs, that they are able to come off many of their other addictions. So definitely, there is something that is happening in the brain that is sort of suppressing, the tendency for wanting to eat more. Now, coming back on that point, when we look at macros in food, be it, say, carbohydrates, sugar, I mean, sugar is not a macro, but in terms of satiety, now proteins and fats are the ones that actually cause the greatest satiety in the brain, and also these two things slow down the gastric emptying, which is what the food hack of sort of tricking the brain to create a GLP-1 analog like effect can be. When you first eat carbs or sugars, satiety doesn't kick in. And actually nowadays what we are starting to see with the obesity pandemic, so to say, we are actually seeing a reactive hypoglycemia patterns that are now starting to happen. And so usually what happens is that many patients will tell you, like about 10:30, 11, after a heavy breakfast, they actually feel their hands are shivering, they're feeling low, and then they go and they get scared and they end up eating more sugar. And sometimes doctors tell them, "Acha, sugar khate raho, ya 2 ghante mein khate raho." And because of this is perpetuating. Before they realize they've gained 10 kgs. And when you start to understand that this is actually because of a mismatched insulin response to the carb load that is causing the sugars to tank, and then you're ending up recreating the cycle. The only way to do that is cut back on the carbs, cut back on the sugar, add the protein, and you get out of this vicious cycle. So these are also things that are little hacks that can help. And coming to what you asked me in terms of my practice, now just today, like actually the last 2 patients of my day today were a husband and wife couple, and the husband weighed 165 kgs, and the wife weighed 135 kgs.
Oh God!
And they have 2 small kids. The husband had lost both his parents. The wife, she's a young homemaker. They're both in their 30s, and 2 tiny kids. And there are so many layers of issues, financial, many issues. And we can talk about what needs to be done. But I think at the very first step is sort of just understanding that this is a really big challenge, and work through it in pieces and in steps. And it's like they've been disappointed. So many, they've tried every diet possible and they've sort of given up. The gentleman is almost willing at this point to kind of consider bariatric surgery, and I do not deny that, because I think he's sort of so far ahead. But I think the one thing I told both of them is, having a purpose to your weight loss journey is very important. You are both parents, your kids are going to be watching you. And when you do a great job in terms of this, you are setting the right things in place for them. The mother said when she was pregnant with her second child, she didn't gain 1 kilogram. And that's often what happens when gestational mothers come in, they'll do anything for the baby. The minute the baby is out, they don't take care of themselves because they've no time. There's so many things going on. So in terms of understanding that there are so many psychosocial issues like Isha and Anuja were talking about, I think that is also very key to getting down to the weight loss part of things.
Right. I would say that I think every family eats together. And today, even I had a patient, and the husband and wife, they came with very non-specific complaints of some giddiness, some pain. And the husband and wife, they told me that somehow we both have gained 6 kgs in last 1 or 2 months. And I said that both of you were eating the same things. Then they said, yes, खाना तो same खा रहे थे. And कहते ऐसा कैसे हुआ कि दोनों ने gain कर दिया? So it's a family that eats together, and what parents are eating, that children emulate or imitate, right? So I think that is wherein you have to tell the patient that creating a purpose and recognizing that food is a family habit, right? And like what about the self-esteem part? I mean, do you think कि जो self-esteem है या body image है patient की, does that play a role? Many
Yes.
think कि basically patient को बोलेंगे कि तुम्हारा body, like is there a perception कि मैं तो ऐसा ही हूँ and I'm going to stay like that and probably, ma'am, what do you say, ma'am, to this? Anuja?
You're asking me?
Yes, ma'am.
Yeah, okay, okay. So yeah, self-esteem definitely plays a very big role, and you can imagine, when these children are also told by the parents, lose weight, this whole society, teases them. For a child who goes to school, they are compared with other children, they are bullied, so obviously it will affect their concentration in studies as well as, their whole activities and what is going in their mind. At times the child will not say, and if it's a direct question to the child that, do you feel this, do you feel that, probably the child will not open up. So we had done a small, we had around 80 questions which we converted into Hindi. It was a I mean, Isha would know this, we had a scoring system there. And so we sort of, it was just yes or no, yes or no. And there were many questions which were put in a different way. The same questions were asked in a different way so that we can evaluate what exactly, there is going on in their mind. And that study actually, we roughly evaluated it. And because we didn't documented at that time, that longitudinal thing is still going on. We are actually refreshing it with the new data. But then what was emerging out of it, that most children had this problem of self-esteem. They had a lower self-esteem, right? So they were depressed somewhere, which they cannot themselves identify, right? And when you actually talk to them in isolation separately, because, at times family member, whether it is adult or a child, adult may be more hiding, they may not be at all expressive about it, right? A child may come out to you in isolation when you say that what is it that you want to share something. And all, at times the children have shared things about their parents itself also, right? So that he doesn't like this, and when he's told like that, then he wants to do it as a, on rebound. He wants to do it because he's not been told properly. He's been told like this, and he's been nagged for, for months together, right? And by their own parents, they are, depressed, and they feel isolated at home itself, right? So I think it's a big issue, and that identifying that issue is also very, very important to motivate them to do whatever we are telling them to do. Without even identifying this, I think it's a useless exercise to give them a diet chart or anything.
Right. What do you say, Isha? So, any experience with the body image issue? Any patient who has come to you and expressed these problems?
Yes, ma'am, surely. In fact, there has been a case that I have seen where the individual was, I would not say obese necessarily, but definitely in the overweight category, and she was a female. Her body structure was such that since childhood she had been like that. And it was not particularly attributable to her overeating or indulging in any binge eating patterns, but generally we humans are designed in different shapes. And unfortunately, the society is not able to understand and accept this simple concept that a mango is going to look like a mango, an apple is going to look like an apple, a pear is going to look like a pear. No matter how much we force or how much we want, a mango is not going to change its shape into an apple. So rather than emphasizing on fitness, on health, people start emphasizing on the body image. So they don't reinforce this. For example, her mother, since her childhood, started to tell her that you're fat, you need to lose weight, you're fat, you're not good looking. So adding on to what already Anuja ma'am said, कि parents बोलते चले जाते हैं, बच्चे बचपन से सुनते चले आते हैं. In return, a child who is not yet capable of logically, absorbing that information and making sense out of that information starts developing low self-esteem because the child is constantly comparing. For example, if let's say the child is a mango they're constantly comparing themselves to an apple, which they can never become. So additionally, how that affects an individual in the long run, even when they become an adult, is I've even seen people who have actually, done weight loss, developed a healthy body, but they're still dissatisfied with their bodies because, again, what they're aiming for is the mango wants to become an apple, which is practically not possible. And this results in their low self-worth. So a lot of times we address the concept of self-esteem and body image. There is something additionally which needs equal importance is self-worth. When a person stops feeling worthy about themselves of in whatever shape they are, in who they are, and whatever their body type is, they're not able to ever achieve the goals that they have, unrealistically set up for themselves. And then people starts to resorting to, all sorts of means, whether it's going under the knife, whether it is unhealthy eating patterns and the negative thoughts, not to undermine them, which continue to play a, very crucial role in the journey of weight loss that keeps on recurring again and again, disrupting the whole cycle that we have already established with the client.
Dr. Sona, what would you like to add, please?
I think body image is a big factor. Sometimes actually it's not just about girls, boys have it big time. I have invariably a lot of young boys who come in around puberty with adipomastia, and gynecomastia, frank gynecomastia too. And they won't take off their t-shirt, they don't want to go swimming. And that's it's, and they are willing to go under the knife because they don't have it in them. They just don't want to step out of their house. They don't study because all the time their minds are full of the thoughts that keep looping around. And it takes a lot of relationship building with patients. Because honestly speaking, when it comes to obesity, as an endocrinologist, my job is really very limited actually, except sort of being there, on the side, making sure there's nothing else worrisome. But most importantly, I think a lot of it, like Isha said, it's really that talk and communicating, understanding, removing those bottlenecks, mental roadblocks, because as much as we know that they would really benefit from a psychologist, the reality is it's very difficult for these kids to actually go there, especially kids, because there is so much stigma. Even grown-ups, for that matter, there could be actually really complicated issues, but getting them to a psychiatrist or a psychologist is really hard. And that is where I've had to upskill myself in at least start off somewhere and get them to understand why I say what I say, and then sort of handhold them and work as a team with everybody else. And so yes, and once depression sets in, it's so under the surface, and invariably a lot of parents come to me with the first question to the endocrinologist is they're angry all the time. Is this their thyroid? Is this their hormones? And unfortunately, it's never the thyroid as much as people like to think it is. It is usually issues in terms of feeling hurt, feeling sad, not being able to express. And that's really what comes out in this behavior. And then it's like a defiance. It's like, okay, what the hell? So there's some group which go that way, and it becomes the angry child, so to say, and the other who's always locked in, starting to get depressed. So all these things across the spectrum happen. So, and I think especially in any family, a lot, at least in the early years, and because now we're really seeing an explosion of pediatric obesity, I think parents have to do a lot. And parents are effectively today, what I see happening is just outsourcing the parenting responsibility, be it to schools, be it to tuition teachers, be it to this. There is no time for the child to connect one-on-one. There's nobody to hear out a child. They are two working parents. I understand the struggle is real. But until we calm ourselves down and be a listener to our kids, I think they will have nowhere to go. And if we judge them, then imagine how society is going to be.
Right. Anuja ma'am, do we have some structured way of, segregating what are the main psychological barriers in a patient who's having challenges while facing a weight loss, or especially if we talk about children? So do we have any structured questionnaires wherein we can segregate ki iska motivation ye hai and we should work on that thing? Is there something?
Yeah, it's all to do with mindful, there's mindful eating schedules, which usually, people have started working on it in India as well. What is mindful eating, you know, and mindful eating actually is not uh, very casually used counseling, but you can actually have a monitoring sheet for mindful thinking, because it starts right from the shopping list, right? It is, what are you shopping? And it is a way of self awareness and self acceptance, accept yourself, is your self awareness and self compassion. So you are working on yourself, so mindful eating is all about that. And I've seen a lot of literature which has about 4 or 5 sheets, the way they monitor the patient in a different way, right? And they track down how he is, while monitoring, you track down how is he changing, how is he positively thinking, the negative thoughts are now converted into positive thoughts. So people have given 8 points of mindful eating or 12 points of mindful eating. It depends from one facility to another facility how they are tracking it, but it has become a big thing, I think. Rather than just jumping onto, advising them some diet plans, or in the initial time, or telling them you start with small physical activity, I think one should track, about how the mind the concept of mindful eating, which starts with a shopping list, and then you come to a table with an appetite, and then start with small portion size, that third thing is a portion size. Then how you learn to appreciate your food, right? So whatever you're eating, initially they will not eat everything healthy, and you don't have to actually tell them that, let them choose from the shopping list, let them choose, when they're shopping, let them choose what they want to shop, right? So you make him a partner in everything, let him decide, let him take the onus of this, and you track it, how is he changing, and you are working along with him. And then take small bites. This is also something which is very important, and it's gaining a lot of importance in our recent things. For everything, small bites, chew thoroughly and eat slowly, so eat on time, right? Which times are you eating, how much gaps you're having between the meals, so all these things are, you're playing on your mind, actually you're changing your mind for self awareness, and you're taking a onus of your own body, and you're actually realizing what is self acceptance. You accept yourself first, and then society will accept you. That is the whole concept, and it is a very structured concept, which at the moment is not gained momentum in India. I think very few people are doing, who are into weight loss. I've heard somebody, a friend of mine, Shiny, talks about mindful down south. So very few people have started doing it, but I think this has a lot of scope. People should do it while tackling with the obesity problem. Yeah.
Right. Isha, I would like to ask you one thing. You talked about the vicious cycle. So it is the behavior and the weight gain, and then there is a further deterioration in the behavior, and there is a cycle, right, that goes on. So negative self-image में तो ऐसा ही self अपने को label करना है ना, right? And then that becomes an excuse for binging again, right? So if, for example, a child comes to you, what are the strategies that you would advise to a parent? कि like इस बच्चे की जो मैं विशियस साइकिल अभी अगर हमें तोड़नी है, राइट? सो वेट गेन बिहेवियर था, वेट गेन था, इम्पल्स कंट्रोल नहीं है, बिंज ईटिंग है, या फिर अब उसके बाद अब नेगेटिव सेल्फ परसेप्शन है, राइट? या सेल्फ एस्टीम थोड़ी सी है, या फिर देयर इज अ क्वेश्चन दैट व्हाई डोंट यू एक्सेप्ट मी एज आई एम, राइट? एंड लेट मी बिंज टू माय फुल. So what would be the strategies to break these vicious ये cycles को जो break करने की बात करें that we're talking about, how do we go about it? Is there any particular way?
While definitely we do follow a structure to it, however, generally in therapy, though we have that structure lined out, generally it doesn't go like this. It sometimes goes like this, and then we are back to square one. So it keeps on fluctuating. However, to answer your question, yes, definitely. The number one thing is that the parent needs to develop a healthy communication with the child. जब तक पेरेंट अपने बच्चे के साथ बैठकर क्वालिटी टाइम नहीं स्पेंड करेंगे, जब तक वो अपने बच्चे से कम्युनिकेट नहीं करेंगे, जब तक बच्चे और पेरेंट के बीच में बॉन्ड नहीं होगा, तब तक तो no matter how many behavioral modifications and habit changes we try to incorporate, it doesn't work out. Second thing is, बच्चे के साथ भी वो चेंज लाने के लिए सबसे पहले हमें बच्चे से बात तो करनी पड़ेगी, कुछ गोल सेटिंग तो करना पड़ेगा to make the child understand how this behavior is not right. What is it? What harm is this behavior doing to the child? Then it also needs to be followed by the parent having to model, which we already discussed during the start, that the parents will have to make the first change in themselves in order to bring that change in the child. So if a parent cannot model that behavior, they better forget about that particular change in the child. Number 3 thing is patience. क्योंकि बच्चों में behavioral changes लाना comparatively difficult होता है, the children are more likely to engage in impulsive activities, क्योंकि उनके brain में अभी उस level का functioning नहीं develop हुआ है that they learn to inhibit their impulses that easily. So उनके साथ हमें बहुत पेशेंस चाहिए होता है और बहुत ही स्मॉलर गोल्स के साथ हमको स्टार्ट करना पड़ता है, so that once the child is able to achieve that one small goal, we reward and reinforce that step, then we go to the next stage. A lot of time parents want कि आज से ही बच्चा खाना छोड़ दे, ऐसा नहीं होता. So a lot of times instead of just completely putting cessation on sugar, we may be asking the parents, अच्छा ठीक है, थोड़ा slowly cut down करने की कोशिश करते हैं. Also there are alternative, जैसे आज की डेट में तो stevia आ गया है, which is an alternate to sugar flavors. So that is also another thing that can be advised. And last but not the least, इन सारी चीजों के साथ कंसिस्टेंसी, कमिटमेंट, कम्युनिकेशन, बच्चे को साथ साथ में इमोशनल रेगुलेशन भी सिखाना बहुत जरूरी है, बिकॉज majority of the children happen to indulge in binge eating is because of the emotional dysregulation that they face. They have not yet developed a healthy emotional regulation system, and unfortunately parents who are not able to model that in front of the children or communicate or educate that the children also do not help in that manner. So this is going to be the roughly entire phase that throughout the journey of weight loss with children that we cover. But इसमें patience बहुत important है, because in any journey relapse happens. Relapse होने पे a lot of times parents and family members become judgmental. तुम तो कर ही नहीं पाओगे, तुम हर बार ऐसे बोलते हो, but they don't understand this relapse तो होगा. Relapse is only a part of recovery. But it's just that we then start to see, अच्छा ठीक है, पहले 1 हफ्ते में relapse हुआ था, फिर 1 महीने बाद relapse हुआ, फिर हम उसको 3 महीने के बाद relapse हुआ. So at least the child is developing that ability to have some kind of what do we call that, कि अपनी craving को control करने की ability तो बच्चा develop कर रहा है ना. So parents sometimes start using relapse in a more judgmental manner. That does not help the child. फिर वो पूरा cycles back to square one हो जाता है.
Right. And I think what you are saying stands true for adults also. Communicating, getting a purpose, and then constant monitoring. Even though the parent is not here, it's instead of a parent, it's self-monitoring and self-motivation, and maybe a counselor or a health coach, like a psychologist or a nutritional coach, can connect at the particular interval periodically, and keep telling them or guiding them or holding their hand.
And also what Anuja ma'am said about mindful eating, which is very strongly correlated to the satiety centers in the brain as well. क्योंकि जब हम धीरे धीरे खाते हैं, the brain takes time to give that message to the body कि now the stomach is full. जब हम धीरे खाते हैं, that allows that time for the brain to send that signal to the body, and we don't end up eating more than what is needed, unfortunately, because people who eat fast do not realize that they are overeating beyond what the stomach actually needs, because satiety center से message आने में time लगता है. So mindful eating is definitely one of the very important parts of a healthy eating habits. I would not even, restrict it to weight loss.
Right. And I think Dr. Sona has left probably, but I just wanted to understand the role of GLP analog and when to start in any particular patient, but I'll ask that question later on. Any other questions from the attendees? Please raise your hand. The panel would be glad to answer those questions. If there are any other questions, please, Mr. Harsh, please unmute yourself and you may ask the question.
Can you guys hear me?
Yeah.
First of all, thank you so much. There was a fantastic discussion. I think it is abundantly clear that weight loss is multifactorial. It's not any one size fits all approach that we can help the society at large. I mean, we've seen the rise in obesity in terms of exponential growth over the last, 20, 30 years. What's interesting is weight loss has almost become a symptom. It's become a symptom of deeper issues that you guys have talked about. It's about the society we live in. It's about comparison. We are constantly being compared. And this is the funny part. Growing up, it's all about comparison. And then suddenly when you're in the corporate world, oh, you need to be unique. What are your sort of skills? What are your unique abilities? So this is very dysfunctional societal framing that we have. And I'm not talking about India in general. It's happening everywhere, right? It is happening in all human sort of evolution. We've always compared people, and one that has to stop. That is a huge driver for a cause of weight loss. Then you have, like Sona said, we don't understand people. We don't listen to people as parents, as adults. We are not listening to people. We are constantly just taking in that information and then just giving out whatever we want to say. There is that big gap in the middle. Where is the processing of other person's emotions, other person's what they are feeling, what they're saying? We're not listening to them. So this whole conversation is abundantly clear that as medical professional, as nutritionists, as dietitians, as coaches, it's not about diet. It's not about what particular food. The issues are very deep. The issues are familial, they're cultural, they're psychological, and everything in between. So just appreciation of how you guys have framed the conversations. Then as a question, I want to ask you, the problems of the societies have just sort of expanded because of social media. It's not so much about comparison between families, your neighbors. It's everything on your phone. You have this definition of what a good body should look like, what a good anything should be, and everyone's becoming an expert at it. They're being expert at it, and they're projecting it on this, and it's in your face. And as a 10-year-old to 14-year-old, you are really getting impacted. So what is the solution to that? How do we combat the issues that have really expanded because of social media? I mean, where do we even begin?
Right. Anuja ma'am?
Yeah, I can just give my bit of, so the whole issue is that we have to reduce the stress of eating, right? And you're saying social media. Yes, social media plays a very big role in, making a role model for people, right? But recently, as you've seen that there's been a bit of a change, that for body image, and it's very consciously done because people have raised issues. Because you see these girls who want to become models, and size zero was one of the things which was very, very popular a few years back. But now with some other actresses, they're saying, why should they be ashamed of their body? Their body built is like that. At times it's true. They can't even go to size 0 because their bone structure is different. They cannot even, and they look nice like that. How at times, this is all in their mind by social media, that this thinness is what you should appreciate and this is what looks good, right? And this is what should be a standard. But now we are actually coming back to, you can see a lot of advertisements who are actually working on it, that this is not the body image, this is how I look is fine. I'm forgetting that, there are 2 3 advertisements, and very I watched these
Dove.
advertisements very carefully, and
Dove has it.
Dove have it, so they actually are coming back. And I would just say, because we don't have any regulation as such as a common person on social media, but then yes, it should be regulated. You are right over there. It should be regulated because it may hurt a lot of people and it may actually depress a lot of people and have a stress on them. Yes.
So, Ms. Kaur, you know that how do adults who battle major depression and may have a fair insight into workings of diet surpass or suppress, I think, unhealthy eating, and it may seem like the only pleasant thing that mental state. So I think Ms. Kaur, Isha answered your question a few minutes back, that I think a lot of monitoring, communication, and support either from a parent or from a family member or a coach. And herein, as if the person is an adult, there is a lot of self-monitoring that needs to be done. Isha, would you like to add something to it?
Yes, ma'am. Purnur Kaur has asked this question. So, number one, if somebody is battling major depression, then the first thing would be medical intervention that would be needed, and the unhealthy eating pattern that may be interfering with that person's functioning will be secondary, because anyhow, a person who would be suffering with major depression will not have any motivation, no matter how insightful that person is. मेजर डिप्रेशन के चलते ब्रेन की फंक्शनिंग उतनी अनफॉर्चुनेटली फैसिलिटेट नहीं करती है हमारी नॉलेज सिस्टम को. सो इवन इफ वी नो दिस इज नॉट राइट, वी मे नॉट नेसेसरली फील मोटिवेटेड टू स्टॉप आवरसेल्व्स फ्रॉम डूइंग समथिंग दैट इज नॉट राइट. सो विद रिगार्ड टू मेजर डिप्रेशन, पहले उस इंसान को मेडिकल इंटरवेंशन की जरूरत पड़ेगी, एंड देन वील वर्क ऑन द मोटिवेशन टू इम्प्रूव देयर अनहेल्दी ईटिंग.
Dr. Sona, there is one is for you. Is stevia recommended for weight loss with WHO reports against its use?
As far as all the stevia has recently had some stevia is among the only things which are relatively safer of all the things that have been now WHO has been recommending against but it's really for not using it as a weight loss kind of thing. It's the safety for that is not the issue, but I think just pretty much avoiding, like say aspartame, all these other sucralose, all these things have come into the recent recommendations that WHO has put out to not use any of these agents, preferably for weight loss. Individually using some of these things is probably very individual in terms of the risk. The ratio is much less. The amounts needed to cause a significant risk is very, very less compared to what is touted. So,
Pratyaksha, you want to ask something? Please unmute yourself. Pratyaksha? Okay. So I think there is another question, 1 or 2 questions we can take, and I think then we have to end the session. Time is already over.
Female with, normal BMI, PCOS, if belly fat loss is the main concern, what should be done? So for belly fat, I think, this is my take on it, one has to, has to go in for some physical exercise, right? And, lifestyle modification involves physical activity, and we as Indians don't do anything. So it is not just a temporary phase where you have to lose your belly. It should be the way of your life. One has to take in some amount of physical activity, and there also psychological thing, and talking with the doctor, as a team, everything is important. Because if somebody just comes ki and is quite motivated, because otherwise the person is fine, normal BMI, but you want to, your belly is loose and you want to shed some weight over there, you want to tone your body, even for toning, for everyday toning, we need to do some walking, some exercise. That should be a way of life, which we Indians are very lazy about, actually. After COVID, I've seen a change. People have started exercising, but over exercising, which has led to a lot of problems, collapse and all that. So it should be a moderate exercise which everyone has to take, but walking does not reduce your belly fat or looseness of your body. So you have to do some belly exercises which are very specific, and one has to get into that.
Just
That is
a
my
word-
personal experience also. And by walking, you don't lose belly fat. You have to do something else for belly.
Just one thing I would like to add from as an endocrinologist. See, I think the one thing about India is we see so many of what we call lean PCOS typically, but there is an increasing understanding about fat. We are now starting to understand that we probably all have a personal fat threshold, and some of that is genetic. And so somebody could look lean outside, but they have visceral obesity. Sometimes it's not just visceral, they might not have obvious visceral obesity, they might have a metabolic markers which suggests that they are in excess fat state. So, and there could be people who are obese who are not metabolically that uncomfortable. They could have perfectly normal cycles, they could have normal transaminases, they have normal sugars, even their insulin levels may not be that bad. So we'll have to individualize for each person what their fat threshold is. The weight at which they cycle normally is probably their fat threshold for them. And I think as Anja said, it's really not just about, we're starting to understand that if you add exercise, especially resistance training or even aerobic, both these things, they actually, the muscles take away the glucose, improve the insulin resistance, improving the metabolic markers very quickly, even before you have any weight loss. But for weight loss, the exercise and all, that's just maybe 5 to 10% more. However much people think about it, 80 to 90% is still the diet. And everything else, so both done together has the maximum bang for the buck.
And adding on to that, there is also another concept about a lot of people try to target, spot weight loss. So they did try to target a very specific spot in their entire body ki bas yahi par weight loss hona chahiye. It does not
Nahi, wo nahi
work like
hota.
that. So just for the belly fat that the concerned person asked, no, it's not going to be targeting only belly fat. So they'll have to engage in activities which will be covering your entire body, and that is the only thing that will help them have their belly loss as well.
So I also feel that aerobics, I don't know, simple aerobics, will it have a major change? I don't think so. I mean,
no, alone aerobics does not, because I'm personally also a fitness enthusiast. So I engage in regular fitness activities and exercise. So and I've been doing that since childhood. It's not that I became a fitness enthusiast as I grew older. So alone aerobics does not help. So beyond a point in time, after, because aerobics is more like a cardio based activity. So after having engaged in cardio for a certain period of time, depending on an individual's body, the person will have to engage in strength training to experience that.
Strength training is really very important.
Yeah.
I think.
Can I ask my question now? I was not able to find the unmute button that time. Sorry. So, I mean, I have depression and ADHD and those stuffs, but it's all medicated. It's all under control. I do therapy. I do strength training regularly. I do mindfulness. So everything has been done. Now my question is, but the emotional eating, like in case of extreme emotions, sometimes like when I'm really angry and I know that like now there's a consciousness that, okay, I am eating out of anger, but still that's the only thing that gives relief at that point of time. Or or maybe eating to stim. For example, in ADHD, you feel very bored because of dopamine, not enough dopamine in your system. So like the consciousness is there, but then how to, change the habits or the coping mechanism, so as to say. Because medication and everything is in place, but still the problems don't go away yet.
So you need Isha.
Thank you, ma'am.
Yes.
Pratyasha, to answer your
Yes.
question, I'm going to ask you one small question. अगर एक person emotionally dysregulated है, and in case of anger, they think they'll only get the relief by hitting somebody. Do you think it is right?
No, तो मतलब wrong जान के ही खा रही हूँ ना. It's called, being a gyan puppy. So, I mean, how to change the behavior, how to modify the behavior is what I'm trying to understand.
I think first thing that you need to do is you'll have to, learn more and more about your anger regulation. What are the triggers for that? And then
Mhm.
developing a healthy coping mechanism for regulating your anger are the techniques. अब उसमें बहुत सारी techniques आती हैं. For me to just say कि नहीं खाना is not going to be sufficient, and also to identify where those triggers are coming from. Sometimes those triggers are very personal, very deep rooted, or maybe coming from, very intimate issues. So in that
Mhm.
case, it becomes even more difficult. However, no matter what the emotion is, if you have been really going through therapy sessions, and if
Mhm.
it's a good therapist, you must have by now covered cognitive distortions. So working on
Mhm.
your own belief system and your automatic negative thoughts is a very important point that we take in therapy, क्योंकि consequence आपके behavior का क्या होगा वो आपके beliefs and thoughts पे depend करता है. So if under the anger, let's say for example, after the anger, your negative thoughts are like, I am the one who's nonsense, I am useless, I am a failure,
Mhm.
nobody loves me. And then the
Mhm.
consequence is to eat food in return,
Yeah.
soothe yourself. So that
Yeah.
thoughts is the area which needs to be worked upon to change the consequence or the coping mechanism also that you are using.
Right. So the core beliefs need to be changed essentially, right?
Definitely. And it is usually it's not an easy as as easy as
Mhm.
so it takes a longer period of time to start becoming more mindful of our automatic negative thoughts and then working on them and then challenging them, because they're so quick and so fast that so many times we don't even know that they've just come.
Mhm.
Adding to
Got it.
adding to what Isha was saying, see, I think, personally, I started researching emotions. That's been my personal passion, and the reality is, like we've talked about, we have our thinking, logical brain and our emotional brain, and when we
Mhm.
are triggered, our brain is in like an emotional hijack. We are not able to
Mhm.
access the rational part of the brain that
Yeah.
can sort of overrule that emotional part. But every time you're getting triggered, that is a clue. There is a real clue of what we need to work on, like Isha said. And when we tackle that as a as an area for sort of personal growth or improvement, I think we can work on it, because there's something that we are going to get better. It's like a landmine. Okay, we are unearthing one landmine after the other, and every time, so we think about allergies. So think about allergies. What happens when you are allergic to something? We tell people to avoid the allergy, right? But sometimes if you're allergic to dust or whatever it is, you cannot always avoid the allergy. A lot of our emotional triggers are also like that.
Like that.
So what happens is, what we might have to try is something like a desensitization protocol. So we're gradually, sort of like Isha said, hand holding somebody to handle those exposures better. And gradually over time, you will get over those triggers, and then those triggers can never affect you. And in the short term, yes, there will be struggles, but gradually over a period of time, you're going to get much, much better. And your self-confidence will go up, because you now realize that, okay, I think I'm starting to get it. And you're going to look at each of these things as an opportunity to become better. If we start thinking like a victim that, I can't help it, this is all I'm going to do. It's going to, if you look at it as an opportunity that, okay, I found another one. Okay, now I'm going to fix that. I'm going to fix this. So then there is a lot of room to grow as a person. And over time, you will start noticing that you're getting calmer and less triggered.
Right.
Okay. So desensitization is the way to go. Got it. Thank you, Isha. Thank you, Dr. Sona.
Yes, and desensitization is not the word that I would use because that is something we use for behavior modification. Maybe detachment is the more appropriate word because emotional regulation.
I was talking in terms of like it's easier to relate to an allergy.
Yes,
What you will
yes,
listen.
yes.
So, but I understand in behavioral therapy terms that might be a different term.
Over here, Pratya. So basically, what I feel that a lot of people who have impulse eating, they like their food presented in a nice manner. They want good food also, and they have a relationship, right? So what I actually tell my patient is that if you are in a relationship with something, so let that relationship work for you. And it is never about the quantity. It is always about the quality of what you are having. And probably one bite is of mindful eating is as good as a whole, right? Remember that probably a bite is as good as a whole, and that might help you, enjoy that particular bite in a better way, right?
Lovely.
I think many a times it's also about realizing that अगर relationship है और उसमें से आप ही हो जिसको आपको manage करनी है, तो let that relationship work for you, right?
Beautiful. Thank you so much. This was like very profound.
So and many a times जैसे आपने बोला कि गुस्सा आता है या aggression है, निशा ने बोला कि हाँ गुस्सा आता है trigger है, तो ठीक है यार, first of all self harm तो नहीं करेंगे ना, right? So that's another thing. So even if you are angry and you have aggression, and the only way you can feel good about is like कि एक अच्छा सा कुछ आ जाए, but then at the same time you have to realize कि excess of anything which is not good for you, that's self harm. So always realize, be a little bit selfish about this part, and always think कि जो मैं कर रही हूँ वो मेरे लिए क्या कर रहा है, right? And I think we discussed a lot about self-esteem, right? The food being a cultural phenomena or a familial eating habit, right? We understood about the cycle as Aisha explained. We understood about the parenting part as Dr. Sona said, and we understood how much stigma and the shame a person or poor self-esteem has when the patient or the person gains weight, right? As ma'am said. But then we also understood during this talk that mindful eating, communication, right? Creating a positive self-image and understanding that probably it is for your good health and it is being kind to yourself and developing a good relationship with food. I think that probably was the nutshell of this panel discussion, and it was a beautiful discussion. I learned a lot, and I'm sure that all the attendees who attended, they learned a lot. I have recorded the session and this would be available. I'll be putting it on the YouTube channel of Knowledge because this is a discussion that needs to be seen by general public, not only by healthcare professionals. And with this, I thank all of you. I thank Ms. Anuja Agarwala ma'am,
Thank you.
Ms. Isha Paul for sparing time. This is a dinner time, and I have, taken your time to discuss this very important topic that I felt that needs to be discussed, and I would love to have another discussion with you in future on or extending discussion further on and give more details. And to the attendees, thank you so much for taking time out and joining us. And I think with this, I would end this webinar today.
Thank you so much. Thank you so much. And thank you.
Thank you.
Yeah, thanks.